Prostate health is a topic that many men avoid, but it's crucial for overall well-being, especially as we age. Yet, there are so many myths surrounding it that can lead to confusion, worry, and even neglect of important health checks. Ever heard that only older men face prostate issues? Or that prostate cancer always shows symptoms early? What if I told you these are just myths that could be holding you back from taking action when it matters most? In today's video, we're diving into some of the most common prostate health myths and busting them wide open. Stay tuned because the truth might surprise you, and what you learn could make all the difference for your health moving forward. First, we have an enlarged prostate means you have cancer. An enlarged prostate does not automatically mean you have cancer, yet this myth has persisted for years. Many people, particularly older men, associate an enlarged prostate with a cancer diagnosis, which can lead to unnecessary anxiety. In reality, an enlarged prostate, known as benign prostatic hyperplasia, BPH, is a common condition that often happens as men age. It involves the non-cancerous growth of the prostate gland, which can press against the urethra, causing urinary symptoms. While both conditions affect the prostate, they are distinct and unrelated in most cases. The misconception that an enlarged prostate signals cancer likely stems from the similarity in symptoms between BPH and prostate cancer, such as frequent urination, difficulty starting or stopping urination, and weak urine flow. However, these symptoms are common to BPH and do not necessarily indicate cancer. Prostate cancer has its own set of unique signs and often develops in a way that does not directly correlate with the enlargement of the prostate. Just because a man has an enlarged prostate doesn't mean that cancer is present or even likely. Moreover, BPH is far more common than prostate cancer, especially in men over the age of 50. Research shows that nearly half of men in their 50s experience some degree of prostate enlargement, and this percentage increases as men age. Despite the prevalence of BPH, the incidence of prostate cancer is much lower, and the two conditions are not synonymous. Most cases of BPH are simply the result of hormonal changes, not cancerous growths. Understanding the difference is crucial in dispelling the myth that an enlarged prostate automatically means cancer. Another reason this myth persists is that both conditions involve the prostate, but they affect it in very different ways. Prostate cancer is a malignant condition where cancer cells grow uncontrollably, while BPH involves benign, non-cancerous growth. The distinction between benign and malignant is key. Benign growths do not spread or invade other tissues the way cancer does. In fact, BPH rarely leads to serious health problems and is often manageable through medication or minimally invasive procedures. Next, we have only older men have prostate problems. The idea that only older men experience prostate problems is a widespread myth that overlooks the complexity of prostate health. While it's true that prostate issues, such as benign prostatic hyperplasia, BPH, are more common as men age, younger men can also experience prostate-related issues. Prostate problems can develop for various reasons, not just age, and understanding this can help break down this limiting belief. Many people assume that prostate problems are a natural part of aging, but that's not the full picture. For instance, prostate infections, known as prostatitis, can affect men of all ages, including those in their 20s or 30s. Prostatitis can be caused by bacterial infections, but it can also result from stress or other factors, leading to inflammation in the prostate. Symptoms of prostatitis include pelvic pain, painful urination, and difficulty urinating, and they can affect younger men just as much as older individuals. This shows that prostate problems are not solely reserved for the elderly, and younger men are also susceptible to prostate issues. Furthermore, it's essential to recognize that while the risk of prostate cancer increases with age, younger men can also develop this condition, though it's less common. Prostate cancer tends to be more aggressive in younger men, often leading to a more urgent need for treatment. However, this doesn't mean that prostate issues are age-specific, as even those in their 40s can experience prostate cancer or other abnormalities. It's important for men of all ages to be aware of their prostate health and not assume that they're immune to problems just because they're not elderly. In addition to infections and cancer, younger men may also experience problems related to prostate function due to lifestyle factors. Poor diet, lack of exercise, and high stress levels can all contribute to inflammation or other issues in the prostate. These factors can lead to conditions that affect the prostate, regardless of age. Prostate health is influenced by a combination of genetic and environmental factors, and men should take preventive measures to maintain their prostate health, no matter how old they are. Moreover, family history plays a significant role in prostate health. Men with a family history of prostate problems may be at higher risk, regardless of their age. This means that younger men with a history of prostate issues in their family might be more likely to experience problems, even if they are still in their 30s or 40s. Prostate health is not just about age, it's also about genetics and personal health history. Next, we have prostate cancer, always shows symptoms early. The belief that prostate cancer always shows symptoms early is a widespread myth that can lead to unnecessary worry or, conversely, a false sense of security. In reality, prostate cancer often develops without any noticeable symptoms, especially in its early stages. Many men are surprised to learn that the disease can grow slowly and remain asymptomatic for years. This is why relying solely on symptoms to detect prostate cancer is not an effective strategy for early diagnosis. One of the main reasons this myth persists is the way prostate cancer behaves in many men. For some, prostate cancer is extremely slow-growing, meaning that it might not cause symptoms for a long time, if ever. The prostate gland itself is deep within the body, and small tumors may not cause obvious problems such as pain or changes in urination. As a result, the disease can remain undetected until it progresses to a more advanced stage, when symptoms such as pain, difficulty urinating, or blood in the urine may become apparent. Furthermore, prostate cancer can sometimes develop in a way that mimics other, less serious conditions. For example, men may experience frequent urination or difficulty starting and stopping urination, symptoms that are often associated with benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. These symptoms are not exclusive to cancer, which makes it harder to distinguish between a benign condition and a potentially serious one. Therefore, many men may ignore early signs or assume they are harmless, delaying proper medical evaluation. Another important aspect of this myth is that not all forms of prostate cancer are the same. Some cancers are more aggressive and may show symptoms sooner, while others remain silent for years. This variability in how prostate cancer presents itself makes it difficult to generalize. For example, high-risk forms of prostate cancer, which tend to spread faster, may show more noticeable symptoms earlier, but these cases are not the norm. The majority of prostate cancer cases are slow-growing and may not cause symptoms until they have already spread beyond the prostate. The lack of early symptoms in many prostate cancer cases is why routine screening is crucial. Men who rely solely on symptoms to detect prostate cancer are at a disadvantage. Early detection through screening, such as a prostate-specific antigen (PSA) test or digital rectal exam (DRE), is the most effective way to catch prostate cancer before symptoms arise. These screenings are particularly important for men over the age of 50 or those with a family history of prostate cancer, as they may be at higher risk. Last, we have prostate health isn't affected by diet. The myth that prostate health isn't affected by diet is one that has caused many to overlook the potential impact that food choices can have on prostate function. In reality, diet plays a crucial role in maintaining prostate health and can influence the risk of developing conditions like benign prostatic hyperplasia, BPH, and prostate cancer. The idea that what you eat doesn't matter when it comes to your prostate health is simply untrue and fails to recognize the important link between nutrition and overall health. Research has shown that a diet high in fruits, vegetables, and healthy fats can help protect the prostate and reduce the risk of conditions like prostate cancer. Certain foods such as tomatoes, which are rich in lycopene, and cruciferous vegetables like broccoli, have been linked to lower prostate cancer risk. Lycopene, in particular, is a powerful antioxidant that may help reduce inflammation and protect prostate cells from damage. This evidence contradicts the myth that diet doesn't impact prostate health, highlighting how specific nutrients can play a protective role. On the other hand, a diet rich in red meat, processed foods, and high-fat dairy products may increase the risk of prostate problems. Studies suggest that a diet high in animal fats can contribute to inflammation in the body, including the prostate. This inflammation may increase the risk of developing BPH or prostate cancer. The high fat content in these foods can also lead to weight gain, which is another risk factor for prostate health problems. The belief that diet doesn't affect prostate health ignores these well-documented associations between food choices and prostate conditions. Omega-3 fatty acids, found in foods like fatty fish, walnuts, and flax seeds, have been shown to have anti-inflammatory effects and may help protect the prostate. These healthy fats are believed to support the immune system and reduce the risk of cancer development, including prostate cancer. Incorporating these types of fats into the diet may help reduce prostate inflammation and support overall prostate health. This information contradicts the myth that diet has no effect on the prostate, as it demonstrates how specific nutrients can actively promote prostate well-being. Additionally, staying hydrated by drinking plenty of water is essential for maintaining prostate health. Dehydration can contribute to urinary problems, which are common in conditions like BPH. Consuming enough water helps keep the urinary tract functioning properly, allowing the prostate to perform its duties without stress. The myth that diet and hydration don't impact prostate health ignores the fact that lifestyle choices like hydration directly influence the function of the prostate and urinary system.